Migraines are often misunderstood. Many people think they are just bad headaches. However, migraines are much more complex. They are a neurological disease. This means they affect the nervous system. Migraines involve a cascade of events in the brain. These events cause a range of debilitating symptoms. Migraines are characterized by intense, throbbing pain. This pain is usually on one side of the head, but the pain can shift or affect both sides. Migraines can last for hours or even days. They can significantly disrupt daily life. The impact of migraines extends beyond physical pain. Migraines can cause nausea and vomiting. Sensitivity to light, sound, and smells are also common. These symptoms can be so severe that they make it difficult to function normally. It's important to remember that migraines are not a sign of weakness. They are a real medical condition. With proper understanding and treatment, people with migraines can find relief and live full lives. Migraines often unfold in distinct phases. Understanding these phases can help with management. The first phase is called the prodrome. It can occur hours or even days before the headache. Prodrome symptoms are subtle. They can include fatigue, mood changes, and food cravings. The aura phase follows the prodrome. Not everyone experiences auras. Auras involve sensory disturbances. Visual auras are common. These might involve seeing flashing lights or blind spots. Some people experience tingling or numbness in their limbs. The headache phase is the most debilitating. Throbbing pain usually starts on one side of the head. It can then spread. The pain intensifies with movement. Nausea, vomiting, and sensitivity to light and sound are common. Finally, the postdrome phase marks the end of the migraine. It can last for hours or a day. Many people experience fatigue, brain fog, and muscle aches. Understanding each phase helps individuals manage their condition effectively. Migraines can be triggered by a variety of factors. Identifying personal triggers is crucial for managing this condition. Dietary triggers are common. These can include aged cheese, processed meats, and alcohol. Skipping meals or experiencing fluctuations in blood sugar can also trigger migraines. Environmental triggers play a significant role. Bright lights, strong smells, and loud noises can all provoke migraines. Changes in weather patterns, particularly barometric pressure, are also known triggers for some individuals. Physical triggers cannot be ignored. Stress is a major culprit. Lack of sleep, poor posture, and even strenuous exercise can contribute to migraine attacks. It's important to listen to your body and identify activities that might be triggering your migraines. Hormonal changes, especially in women, are closely linked to migraines. Fluctuations in estrogen levels throughout the menstrual cycle can lead to menstrual migraines. These migraines often occur around the time of menstruation. Diagnosing migraines involves a comprehensive approach. There is no single test to confirm a migraine diagnosis. Doctors rely on medical history, physical examination, and ruling out other conditions. Keeping a detailed headache diary can be very helpful. This diary should track headache frequency, duration, intensity, and potential triggers. It's important to see a doctor if your headaches are severe, frequent, or interfere with daily life. Sudden onset headaches, especially if accompanied by fever, stiff neck, or neurological symptoms, warrant immediate medical attention. These symptoms could indicate a more serious condition. Doctors often use imaging tests like MRI or CT scans. These tests rule out other causes of headaches such as tumors or aneurysms. Once other conditions are ruled out, and based on the individual's symptoms and history, a migraine diagnosis can be made. Early diagnosis and treatment are essential. Prompt management can help prevent migraines from worsening and reduce their impact on quality of life. Don't hesitate to seek medical help if you suspect you might be experiencing migraines. Section 5. Conventional approaches. Navigating treatment options. Treating migraines involves a multifaceted approach. The goal is to relieve symptoms and prevent future attacks. Treatment plans are individualized. They depend on the frequency, severity, and impact of migraines on daily life. Pain relievers are often the first line of defense for acute migraine attacks. Over-the-counter pain relievers such as ibuprofen or naproxen can be effective for some people. Triptans are prescription medications that specifically target migraine pain. Preventive medications are considered when migraines are frequent or severe. These medications are taken regularly to reduce the frequency and severity of attacks. Beta blockers, antidepressants, and anti-seizure medications are examples of preventive options. In addition to medication, other therapies can be helpful. Nerve blocks involve injecting medication into specific nerves to block pain signals. Biofeedback is a technique that helps individuals control certain bodily functions, such as muscle tension, which can reduce migraine frequency. Section 6. Nature's embrace, remedies, and lifestyle modifications. While conventional medicine plays a crucial role in managing migraines, natural remedies and lifestyle changes can complement traditional treatments. Some people find relief with techniques like acupuncture or massage therapy. Acupuncture involves inserting thin needles into specific points on the body to alleviate pain. Massage therapy can help relieve muscle tension, a common trigger for migraines. Certain herbs and supplements have shown promise in reducing migraine frequency and severity. These include magnesium, riboflavin, also known as vitamin B2, and feverfew. It's crucial to consult with a healthcare professional before taking any new supplements, as they can interact with other medications. Lifestyle modifications are essential for long-term migraine management. Getting regular exercise, prioritizing sleep, and managing stress are paramount. Techniques like yoga, meditation, and deep breathing exercises can be incredibly beneficial in reducing stress and promoting relaxation. Dietary changes can also play a significant role. Identifying and avoiding personal trigger foods is essential. Staying hydrated by drinking plenty of water throughout the day is also crucial. Small, frequent meals can help stabilize blood sugar levels, preventing fluctuations that can trigger migraines. Section 7. The hormone connection, menstrual and hormonal migraines. Hormonal fluctuations, particularly in estrogen levels, are strongly linked to migraines in women. Menstrual migraines, as the name suggests, are associated with the menstrual cycle. These migraines typically occur 2 to 3 days before or during menstruation, when estrogen levels drop. Hormonal migraines can also be triggered by hormonal changes during pregnancy, perimenopause, and menopause. Women going through these life stages may experience changes in migraine patterns. Some women find their migraines improve during pregnancy, while others experience more frequent or severe attacks. Managing hormonal migraines often requires a combination of approaches. Tracking your menstrual cycle and migraine patterns can help identify hormonal triggers. Hormone therapy, such as birth control pills or estrogen patches, may be recommended to regulate hormone levels and reduce migraine frequency. It's essential to work closely with your healthcare provider to determine the best course of treatment for hormonal migraines. They can help you weigh the risks and benefits of different treatment options and develop a personalized plan. Section 8. Migraines in the young, symptoms and treatments. Migraines are not limited to adults. Children and teenagers can experience them too. In fact, migraines can start as early as infancy. While the symptoms of migraines in children are similar to those in adults, they may manifest differently. Children experiencing migraines may complain of a stomachache rather than a headache. They may be unusually irritable or withdrawn. Younger children may not be able to articulate their symptoms clearly. It's important to pay attention to behavioral changes that could indicate a migraine. Treating migraines in children involves a cautious approach. Lifestyle modifications such as ensuring adequate sleep, managing stress, and identifying trigger foods are often the first line of treatment. Pediatric neurologists or headache specialists can recommend appropriate medications if lifestyle changes alone are not sufficient. Parents and caregivers play a crucial role in helping children manage migraines. Creating a supportive and understanding environment is essential. Educating children about migraines and empowering them to identify their triggers can help them take an active role in managing their condition. Section 9. Living with migraines, daily management, and future hope. Living with migraines can be challenging, but it doesn't have to control your life. By taking an active role in managing your condition, you can minimize the impact of migraines and live a full and meaningful life. Here are some tips for daily management. Keep a headache diary to track your migraines, including triggers, symptoms, duration, and medications used. Manage stress by practicing relaxation techniques like yoga, meditation, or deep breathing exercises. Prioritize sleep by aiming for 7 to 8 hours of quality sleep each night. Stay hydrated by drinking plenty of water throughout the day. Eat regular meals and avoid skipping meals to maintain stable blood sugar levels. Exercise regularly with moderate intensity exercise most days of the week. Avoid triggers by identifying and minimizing exposure to your personal migraine triggers. Communicate with your doctor by regularly discussing your symptoms and treatment plan with your healthcare provider. The future of migraine treatment is full of promise. Researchers are constantly working to develop new and innovative therapies. New medications, such as CGRP monoclonal antibodies, are showing remarkable efficacy in preventing migraines. Neuromodulation devices, which use electrical or magnetic stimulation to target specific nerves, are also emerging as promising treatment options. Remember, you are not alone in this journey. With the right knowledge, tools, and support, you can take control of your migraines and and live a fulfilling life. Stay informed, stay proactive, and never lose hope.